morning, everybody. And I'm a sort of people call me the Bhishma Pitama, as they say, of pediatric oncology and hematology in our, at least in the northern part of the country. When I started my practice way back in 1990, which is now almost 34 years back, and how I have seen it evolve over a period of time, I think 3 words say it all. It is from nihilism to cautious optimism to celebration. Now, people say, yesterday we were talking about World Thalassemia Day, and I said, in the poster we had written celebrating World Thalassemia Day. And one of the people questioned me, what is there to celebrate in thalassemia? The poor kids suffer so much. They have to undergo blood transfusions, medication, their lifespan is not very good. So what are you celebrating about? So I said to him, I celebrate the power of these brave hearts. I celebrate the life of these brave hearts. I celebrate the grit of these brave hearts. And I celebrate the fact they are living and doing well and even studying, going on to doing jobs, working, and despite their illness. So there's a lot to celebrate. There's a lot to celebrate in cancer also. Let's talk about a child who comes to me with cancer. And the first thing which the patient says and the parents say, why me? Why me? And that's, even if he doesn't say it to me, in his heart he has this question. Why me? What have I done? God, मैंने क्या किया जो मेरी को ये मिला? तो मैं उनको ये बात कहता हूँ कि तुम खुदा के बंदे हो और खुदा अज़मत में उसी को ही डालता है जिसके ऊपर उसको दृढ़ वो है कि पक्का दिस थिंग कि वो इसको ओवरकम करेगा. If God has given you a child, a gifted child who has got cancer or some grave disease, He has confidence in the fact that you will overcome that and you'll take care of that child. So that is the kind of positivity we have to create in our patients, because when they come, it is like a shock. And the shock is also not on this, that, I have, and generally speaking, let me tell you that when I started my practice in 92, 93, it was actually in 1990 that I started my practice. Initially, the young children who come to us are children of upcoming parents. When I say upcoming parents, they are struggling with life, they are struggling to make their life, they do not have the kind of money, they do not have the wherewithal to take care of a child like this. It is expensive to take care of. Leave aside the actual expenditure on the medication and hospitalization. Expense is also involved in this thing, that you are leaving your job, you are taking holidays, you are off work and off money also. You are going hundreds of kilometers away to some other city and spending on that also. It is very, very tough. And usually what is done is that they are supported by their parents and grandparents, etc. It's a very sad commentary that in this period, I have heard the statement, अरे छोड़ो इस बच्चे को, इतना खर्चा हो जाएगा, इससे अच्छा तो एक बच्चा और कर लो. Let this child go. And that is the morality of economics in our country. It's easier to produce another child than to take care and spend on a child with cancer. That is nihilism, as I saw it in the first few years of my practice. Now comes cautious optimism. With the advancement in our country, with the liberalization in our country, a lot of people are covered by their companies, insurance. Now the government of India has also brought in insurance for the people who are below poverty line. And that has given us a glimmer of hope that we will be able to take care of these patients. I'm first going into the economics, and then I'll talk about the treatment part also. And it has become easier to treat. And believe me, in the last 1 decade, people like you, people like who are, we saw this in States and in UK, that a lot of people donate to charity for these purposes. I'll give you an example of St. Jude's Children's Hospital in Memphis. They have a system that the small kid going to the school will donate $1 in a month or so from his pocket money for St. Jude's Children's Hospital. And they collect hundreds of thousands of dollars to that. The kid is put into the habit of putting money for good institution. And that habit is carried on as an adult, and that what dollar turns into 10, into 100, into $1,000. And that is how they are running their institutions. It has made, I remember when I was working in Royal Marsden in London, they had made a barometer. They were needing about 50 million pounds, and the barometer was in 1 month it was 10 million, the next month it was 10.5. It was shown as red on that barometer. So it was, a message was being given to the public also, and we are seeing that happen now in our country. A lot of people are donating. I receive calls from all over the country where they ask me, this patient has put his name or her name for funding. Is this true? Is this correct that this patient has this cancer and is in need of money? So there is no dearth of money. The dearth is of lack of trust. There's a lack of trust that whether what I'm donating will reach the right person or not. So that is cautious optimism from the economic point of view. Another example I'll give you, McDonald's has Ronald McDonald houses in US and in other countries where children, when they come for their treatment, their parents are allowed to stay free in those houses, in rooms, with all the facilities, and they take care of their kids. They can stay for a month, 2 months, and they have started that here also in our country. It may not be a Ronald McDonald house, it may be a Ronald McDonald room, restroom, something of that sort of a thing for the patient's relatives to stay and sit whilst their child is getting treatment. The success stories of our patients are that today I have children who were treated by me at 4 or 3 or 4 years, and they have their own children. They are married, they have their own children. Only a month back, one of my patients whom I had lost touch with, treated, cured, absolutely fine, and he came to me, and he came to me with his girlfriend. And he said, we are planning to get married. Can you tell us what is the impact which we may have or face in our life ahead because of the treatment or because of the cancer? All that he needed was assurance, and his would-be fiancée wife needed assurance. I assured them, and they have got married. So that is, again, optimism for every one of you. Now, coming to the 5 C's which Harpinder mentioned, no doubt you need compassion, need the support of, I've always maintained, हर इंसान की 2 लातें हैं, और इंसान चलता ही तब है जब दोनों लाते काम करें. And I tell the patients and the parents when they come to me for counseling that this child also has two legs. One leg is you and your support team, which may be your father, mother, brother, sister, whatever, friends. And the other leg is me and my support team. If we work in tandem, we'll make this child run. If there is a period when one leg is injured, and when I say one leg is injured, today you are injured, you are in distress, you are in pain, it's the responsibility of the other leg to support you and take care of you and nurture you so that you can overcome that pain, that distress which you are facing today. And if I am in distress, then it is your duty to support me. And I am in distress when my patient is in distress, when he's passing through, he or she is passing through a bad patch. And I tell you that this is what we are feeling. Instead of feeling anger, you should support the doctor. The doctor and the patient is one team which will make the patient run. And don't forget that even if I'm sitting in my chamber on one side of the table and you're sitting on the other side of the table, it does not mean that we are opposite each other. We are together. No doctor will ever like his or her patient to suffer because of his problems. Let me tell you, in children, how long will I live? That is the other question. That's a very adult-centric approach. You know why I say adult-centric? Because in children, we don't say that you live for this long. We never say that. We say cure rate in this cancer is 90%, 80%, 75, 50, whatever the cure rate may be, depending on the stage, the kind of cancer it is. Remember, it is cure rate we are talking about. We are not talking about living for 2 years or 3 years. If I can't give a fruitful, long life as a normal functioning adult to a child, it is very difficult. So we always talk about cure rates. So pediatric oncology is slightly different from adult approach, and we use that approach. Then coming to communication. Communication is a two-way pathway. It is not a one-way traffic thing. The doctors have to learn how to communicate. When we were in med school, we were never ever taught communication skills. We are honing our clinical skills. Whatever communication skills I have learned through my years of practice and ways of talking to the patient. Not every patient can be talked with in the same way. And you learn to find out nuances in the talking of the patient by which you modulate your communication skills. Despite that, there are patients and parents who tend to not see or ignore what you are telling them. That is their way of self-defense. आप देखते हो कि जी हम कहते हैं ना, कबूतर बिल्ली झपटती है तो आँख बंद कर लेता है, thinking that this has gone away. So you close your mind to whatever your doctor is saying, and that leads to miscommunication. Now, I'm not saying that it is their fault. It is absolutely not their fault. The fault in that situation also lies with me as a doctor, because I have failed to recognize what they are doing. They are protecting themselves by closing their eyes to this thing. And it is very important that we open our eyes and go into the treatment, into the positive aspects of cancer properly, because only when you recognize there is a problem will you will take action to take care of that problem. So these are the issues which we have to always talk about. Now coming to, kind of, I said nihilism to cautious optimism to celebration. Celebration, why? Because over a period of time, we used to have this policy of one thing fitting all, one answer fitting all. Can somebody hold this? Thank you. One size fit all. 1990, whatever we had, for example, for blood cancer, we used to have one size fits all. Everybody used to get the same treatment, same this thing, and some of them would actually need that, never needed that high a treatment or that toxic a treatment. Some of them needed more toxic treatments and they would relapse, and some of them would die because of the toxicity of the treatment, because we didn't know that they were not that severe cancers or that bad cancers, and they ended up needlessly dying because of the toxicity of the treatment. But now we have ways and means and methods to diagnose, to follow up these patients properly with the help of genetic testing. And I mean, a simple thing, Dr. Bhargav is sitting here, a day 8 blast cell count, which is very simple to do, helps us in prognosticating the patient, which is not even requires any genetics. So it is very important that we incorporate and we understand that now there is no one size fits all kind of a thing. And that's a thing to celebrate, because a patient who's not going to need that toxic a treatment gets a modulated, less toxic. Yes, of course, despite all efforts, some patients may relapse. Some patients may come back with the disease. Some patients may still die, but then that is a part of the whole story. And I tell you that somebody was asking, hours of sleep. In my younger days, until the age of 55, 60, I hardly ever slept 4 hours a day. Hardly ever slept 4 hours a day. If my patient would be sick, I would spend sleepless night thinking, could I have done something more? Can I do something more? People don't realize that. We all go through this process, and we all go through these anguished moments. And let me tell you, I always tell everybody, all my fellows, and I have more than now 80 fellows whom I have trained, and they are spread all over the country, including with Dr. Rahul in his team. I always tell them that a part of my heart always dies when a patient of mine dies. And it is never replaceable. You go through this day in and day out, and it affects your health, it affects everything. To this extent that it affects the relationships in your family also. So these things happen. Coming to what we will be talking about in the next hour or so on precision oncology. I'm reminded, I said that, of the Times magazine cover of Magic Bullets in 2001 or something. It came in 2000, 2001. The best magic bullet you can have is compassion, empathy, and also taking care of your patients. That's the best medical, magic bullet. One of my teachers who taught me in my med school said to me that, Anupam, did you learn your medicine on what kind of patients? I said, usually they were poor patients. So he said, so it is mandatory you hand back whatever you have learned from them, and you must take care of those poor patients. So equitable distribution of medical knowledge, medical treatment is also an important issue. These are the developments which I have seen. We are seeing a little bit of equitable distribution of medical knowledge and treatment now. Thank you very much.